We've been talking about some pretty heavy topics lately, so today I thought we'd talk about something equally as important, just a little bit later. It's something we teach to everyone, and yet it wasn't something that was commonly practiced, if you can believe it, until the 1940s. It's something you do every day, hopefully more than once, and is required in just about every profession there is. Have you guessed what it is yet? No? How about a few more hints? The first time it was seen as a medical practice was during the American Civil War. This is something that has slowed and in some cases even stopped the spread of disease. If you guessed hand washing as today's topic, you'd be correct. So let's start with how and when do we wash our hands? Here's the how. Follow these 5 steps every time. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your fingernails. Scrub your hands for at least 20 seconds. If you need a timer, hum the happy birthday song from beginning to end twice. Then rinse your hands well under clean running water. Dry your hands using a clean towel or an air dryer. Here's the when. You can help yourself and your loved ones stay healthy by washing your hands often, especially during these key times when you're likely to get and spread germs. You should wash your hands before, during, and after preparing food, before and after eating food, after using the toilet or changing diapers, after touching an animal feed, or animal waste, after handling pet food or pet treats, and though it can be tedious, you really should wash your hands after blowing your nose, coughing, or sneezing. So now that we've talked about the how and the when, let's talk about the why. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can help stop germs from spreading from one person to another in our communities, including your home, workplace, schools, and childcare facilities. Washing hands can keep you healthy and prevent the spread of respiratory and diarrheal infections. Germs can spread from person to person or from surface to person when you touch your eyes, nose, and mouth with unwashed hands, when you prepare or eat food and drinks with unwashed hands. It can even be spread when you touch surfaces or objects that have germs on them. Gross. Now back to the history of hand washing. Ignaz Semmelweis, a Hungarian doctor working in Vienna General Hospital, is known as the father of hand hygiene. In 1846, he noticed that the women giving birth in the medical student/doctor-run maternity ward in his hospital were much more likely to develop a fever and die compared to the women giving birth in the adjacent midwife-run maternity ward. He decided to investigate, seeking differences between the two wards. He noticed that doctors and medical students often visited the maternity ward directly after performing an autopsy. Can we see where this is going? Based on his observation, he developed a theory that those performing autopsies got cadaverous particles on their hands, which they then carried from the autopsy room into the maternity ward. Midwives did not conduct surgeries or autopsies, so they weren't exposed to these particles. As a result, Semmelweis imposed a new rule mandating hand washing with chlorine for doctors. The rates of deaths in his maternity ward fell drastically. This was the first proof that cleansing hands could prevent infection. However, the innovation wasn't popular with everyone. Some doctors were disgruntled that Semmelweis was implying that they were to blame for the deaths, and they stopped washing their hands, arguing in support of the prevailing notion at that time that water was the potential cause of disease. Semmelweis tried to persuade other doctors in European hospitals of the benefits of washing hands, but to no avail. Unbelievable. A few years later, in Scutari, Italy, the Crimean War brought about a new hand-washing champion, Florence Nightingale. At a time when most people believed that infections were caused by foul odors called miasmas, Florence Nightingale implemented hand-washing and other hygiene practices in the war hospital in which she worked. While the target of these practices was to fight the miasmas, Nightingale's hand-washing practices achieved a reduction in infections. Sadly, the hand hygiene practices promoted by Semmelweis and Nightingale were not widely adopted. In general, hand-washing promotion stood still for over a century. It wasn't until the 1980s when a string of foodborne outbreaks and healthcare-associated infections led to public concern that the United States Centers for Disease Control and Prevention identified hand hygiene as an important way to prevent the spread of infection. In doing so, they heralded the first nationally endorsed hand hygiene guidelines, and many more have since followed.